how do people find the right provider for them? There's so many different providers. So what would be, a 1 or 2 minute word of advice for our patient population out there that we know that they're ME/CFS, which means they've probably been sick for a long time. We have our long COVIDs. We see who's here today. So there's so many specialties. There's so many different types of providers. What would be your gem of wisdom of how to find the right provider for them? And I'm going to go around the room just to my immediate left, which would be Dr. Cohen. You're on mute. And if you could talk a little bit closer, you're still on mute. There we go. Okay, there you go.
I actually have headphones in, so it doesn't matter. Well, it's always been a difficult question. Actually, I did a little plug for my book, which actually has all of the information about NCCAOM and all of that in there. So I always recommend that people look for certainly a local provider as much as possible, but sometimes you won't find somebody local. But if you can, you want to, when you call, you want to call their office and not just make an appointment with somebody just because they happen to be close to you. You want to call them and say, do you have experience in this area, and how much experience do you have, and do you practice acupuncture? Do you practice herbs? Do you use qigong? What do you do in your practice? So even if you personally don't want to do that, you can also have someone call for you and get that information. I think it's really important. Also, using organizations like today, talking to the other people, doing it in the chat room. Who have you found that works for you? I think that's an almost even better place, to find out, is to work with your peers, So that to me is but that's how I would do it, and that's how I do it as a practitioner. I don't ask it's interesting. I think if you ask a doctor for recommendations, a lot of times that doctor actually will give a recommendation, but doesn't have any idea who that person is. It's just somebody they heard of. And so you want to know if your doctor actually has experience with those providers as well. So if you do ask your doctor for recommendations.
Thank you so much. I concur.
Sure.
Experience. Do you have experience? That is really, really important. And Amy?
So that is important, but really what's more important for me, I think, especially for anyone with chronic illness, is, are they a good match for you? So if you can set up a time for the provider on the phone or a little bit of a telehealth, because you want to see and be heard, right? Anyone with any kind of chronic or autoimmune illness, that's really imperative because that affects their healing, right? So do get a reference, do call a couple of people, see what the responses are, and find someone who meshes with you. And if you don't, you can also reach out to your local acupuncture society about where you live and what's going on for you, because everyone deserves to have a provider that treats them with respect, that is very smart, that is experienced in what they're looking for, and that knows how to refer and help you find someone else if they're not the provider for you, right? I'm not the match for everyone, and if I'm not, I'm totally committed to helping you find the person who will help you be your best self and help you heal. And to you, Dr. West.
Absolutely. I do lots of referrals out, and I do a free 15 with all to see if we're a good fit. And also knowing when to go. If you're like not getting better and it's been 6 months and you're spending a lot of money, it might be time to, I get some people, some long COVID, some chronic, they've been with people for like a year and they're not getting better. They're with me a few months and they're getting significantly better. It's all about that perfect fit. So thank you so much and someone who can listen to you and gives you what your needs are. Some people don't want to talk to you. They just want you to give them the stuff and move on their way. So it's the right fit for you. And Dr. Wen, what would be your words of wisdom to the patient population today?
No, I think if I were the patient, I would say it's like, okay, today's time, the technology is very advanced. We can do a telemedicine, we can do a consultation, we can to see if, back to your question is like, it got to be the good fit. A lot of times, the practitioner are qualified, but they're just not a good fit for you. So what's the good use of that, right? So, but after 15 minutes or half-hour consultation, you have a sense, they have idea what you have, to see if that will be a good, good matter. Because we're not talking about, oh, you just had a headache, right? Yeah, your back is out, just a couple of visits. We have chronic fatigue syndrome, at least few months, if not like half a year, a year or longer. So you want to get started with that. Yeah. First is like, okay, try your best, make sure that is a good fit. So I recommend is like, okay, start with the consultation first. Yeah. To see if you're comfortable, if you think they can help you or not. Yeah. And go from there.
Yeah, that's wonderful. Thank you so much.